Hi, so this is your great option for your nursing home care solution or home health care solution built into one. Now, here's the deal. When it comes to nursing home care, skilled nursing care, the way this typically happens is, you have a hip replacement surgery or something happens to your knee or you have a stroke and you need to go to skilled nursing for a while to recover, right? And in that situation, if you can get that covered by Medicare for 20 days, but only if you've been hospitalized for at least 3 days. And that becomes a problem because you're not always hospitalized for a full 3 days. Part of it, you may have been under observation status, not considered true inpatient status. So there's little holes and gaps you can fall into where, oh, well, Medicare is not going to pay for this skilled nursing stay, right? That's number one. Number two is even in the skilled nursing situation, you'd rather get services at home. More and more, we prefer to be at home around our pets, our family members, and so forth. But Medicare won't pay for that. I mean, they'll pay for very minimal and only after jumping through a bunch of hoops, having someone come in and maybe administer a drug or two. But then they're in and out. That's it. Nothing for helping you with, bathing, cleaning, cooking you something to eat, taking you to get your drugs, or picking up your drugs for you, or anything like that. So that's there in this breakdown right here. But first, 70% of folks end up in some sort of situation, like that over the age of 65, and it shows some costs here. Private room at a skilled nursing facility is about 112 grand a year, and it's going to projected to be about 141 grand a year. The average cost of a one bedroom at an assisted living is about 55 a year, expected to go up to about 70,000 a year. So we're trying to get coverage that will help us either in the skilled nursing situation or at home, depending on what our preference is and what our situation is. And that's what we're up to here. Now, um, this policy by Aetna allows you to use the benefit for either. Okay, and it's much more affordable than standard insurance for long-term care only. Number one, long-term care only insurance for a nursing home only costs about $500 a month to start. Very difficult to get from an underwriting standpoint. Price will go up over time, and it's kind of wasteful for most folks because the stats show Google, how long does the average person stay in a long-term care nursing home? Truth is, it's about 2 years or less than 2 years, because the truth is, if you can't perform two of the six daily activities of living anymore, bathing, dressing, feeding, those are some of those, then you're on the way out. Honestly, it's what the stats show. Most folks are not surviving in a long-term care situation. So the sweet spot then for what to cover is a policy that covers long-term care up to 2 years. Also covers short-term care in the home. Also covers recovery care in an assisted living facility, and that is all built into this policy for about $159 a month for the way that I have it set up to give you a year of at home care, a year in the facility care. That's 2 years total, and between those two, if you need something beyond that, then the odds are very unlikely you're going to need something much beyond that stat show. But if you are wanting something beyond that, I have that available. But that would be getting in the $500 a month range, and it goes up from there for long term care. Okay, so this policy you get to choose how you want to use it in a nursing facility, assisted living facility, or at home. Okay, it pays a daily benefit amount for the nursing facility and the assisted living facility. It pays a weekly amount for a home health care aid. What does a home health care aid get you? Well, uh, things not provided by Medicare that that shows right here: um, housekeeping and laundry, dressing, bathing, meal prep, physical, occupational, speech therapy. You can still get all of your therapists that you might get in a skilled nursing facility to come to you instead. So you had a stroke, you need speech therapy, you can have them in home and have that service. Shopping but you can also have separate from that a personal home health caretaker, aide, nurse, separate from those specialists. That's just for home care to help you with shopping, medications, get your supplies, things like that. So that's what's great about this plan. You use it in the facility or have the facility specialist come to you separately. Also, a home health aid benefit. So I've got 52 weeks of this built in the way that I have it set up here for this. So again, facilities are a daily benefit. I have 300 a day for 360 days. And then the home care is an optional rider. You don't have to have it, but for the purposes of this quote here for you today, I have it set up for 52 weeks of $600 a week. So you get $600 a week for a home health aid. Cost is $159 a month today as of August 2023. Could go up a little bit, but that's what it is today. That covers the basics of what you need. You could get a year at home, then do another year in the facility. It doesn't have to be that way. You could do, a certain number of months one place and certain in the other. But I have up to a year built in for each option, in home or at facility, and you use it as you see fit. So payment stays the same, doesn't go up, and um, it's much easier to get from an underwriting standpoint than your traditional long-term care. So this is what I suggest for long-term care, and then or rather intermediate care, I would say. And then if you want something that gets you beyond 2 years into traditional long-term care, then I can assist you with that. But this, I think, would solve that hole for most folks. So I'll include the brochure with this. Have a look and let me know your questions and what you think. Let's take it from there. All right. Talk soon.